Hello viewer, I'm Timothy Osemenge, the president in ITV and radio. Today we're going to be bringing to you health matters on Inner ITV and radio. And to do justice to that is one very health inclined personality. Yeah, and those Bana, can we get to meet you?
Okay, good evening. My name is Irene Uabor,
Okay.
State Health Educator, Edo State Primary Healthcare Development Agency. Yeah.
So what is new in that sector?
Okay. Presently, Edo State Primary Healthcare Development Agency is planning on a vaccination campaign in the state. Okay, it's called the HPV vaccination, that vaccine that helps to prevent cervical cancer. We had HPV vaccination last year, 2024, if you can remember very well. But so far, we vaccinated girls between the ages of 9 and 14. But the number, the target was quite low for Edo State and many other states. So the federal government deemed it fit that there be another round of the HPV vaccine, which is the human papilloma virus vaccine, like I said, that helps prevent cervical cancer. And cancer of the cervix is found in women. So this time around, we're going to be vaccinating girls that are 9 years of age in Edo State and in the entire nation. So Her Excellency, the First Lady, Federal Republic of Nigeria, Senator Oluremi Tinubu, flagged it off on the 6th of October in Abuja. That was the national flag off. And that kicked off the first phase of the human papilloma virus vaccine campaign. So Edo State falls within these phase 2 states that will be carrying out this vaccination for girls for girls that are 9 years of age. So Edo State phase 2 starts in January 2026. So but now we're trying our best to create awareness out there for people to be aware, parents, caregivers, guidance. Then of course, talking about talking about girls that are 9 years of age, we'll look at the education sector where we see children in schools. So advocacies have been paid to several education sector ministries, departments and agencies to ensure that they are aware of the vaccination that will be commencing this October. That's for the HPV. HPV will be commencing in October and from October to December. The human papilloma virus vaccination, October till December this year.
That's been 2025.
Yes, 2025.
Okay.
Okay, I think I made a mistake.
Okay. Okay, so 2025.
Yeah.
But you talked about 2026 earlier.
Yes, the 2026 I'm talking about. In 2026 January, we'll be having another vaccination schedule.
Okay,
but this is going to be for, it's called the measles rubella vaccine.
Okay.
The measles rubella vaccine is for children between the ages of 9 months to 14 years. Okay, let's not confuse.
Okay.
Yes, measles rubella is for children between the ages of 9 months to 14 years for all children. But the human papilloma virus vaccine is for girls 9 years of age. And that human papilloma virus vaccine that helps prevent cervical cancer, the vaccination commences October this year. It starts this month till December in Edo State.
Or 2025.
Yes, 2025. Then that of the measles rubella commences in January 2026. Sorry, that was the one that the Senator, the First Lady Senator Oluremi Tinubu flagged off in Abuja on the 6th of October. That's the measles rubella vaccine. Yeah.
So before we let you go on the show, what should be your advice for every citizens of these states as regards the manner with which they should manage their health, budget?
Okay, so as we know, vaccine is a preventive measure. It is not curative. So vaccines are meant to prevent several diseases. In this case, we're talking about measles rubella and the cervical cancer in women. So my advice would be Yes, we know there are a lot of rumors out there about vaccines and all of that. But my advice is that caregivers, parents should be aware that our vaccines are good, our vaccines are safe, they are effective, and they are given free of charge. They are kept under the right condition in our cold store. Our cold chain is perfect, and there is no need for any alarm whatsoever. Whatever rumor you hear, just know that vaccines are effective, they are safe, and they are given free of charge.
So how many of these vaccines do we have in a routine for every year? Like how many of these vaccines do people need to get to hear of? What should they expect to be, applied on your world, their children, as the case may be?
Okay, generally we have routine vaccines from birth till 9 years of age now. Used to be from birth till like 15 months. But now that we have the human papilloma virus vaccine that prevents cervical cancer, we take our vaccines, routine vaccines for our children from 0 to 9 years of age. That's the complete schedule for routine immunization
So can
in
we
Nigeria.
mention some of these vaccines that people
Okay,
should
okay. I
expect?
mentioned, yes, we are all familiar with the polio vaccine,
Yeah.
the oral polio vaccine, which we go about giving our children between the ages of 0 to 5 years of age. The measles vaccine, and going forward, I know I mentioned the measles rubella. Going forward, single dose measles vaccine will now be measles rubella. It will not be a two vaccine in one, but will be given as one. This is because apart from the measles infection we keep having, rubella is also part of it. The one people call German measles. So because of that, we are ensuring that as we curb the measles infection, we are also doing the same for rubella. Rubella was not part of the routine immunization, rubella vaccine, but now it's being introduced, thanks to our government, into the routine immunization from this year.
So what's cervical cancer for those persons who are just perhaps joining us on the show?
Okay, so cervical cancer is simply means cancer of the cervix. So the cervix is an organ, or is a part of a woman. You don't find the cervix in a man. So the cervix is like the neck of the womb, the neck of the uterus. So that's where the baby, maybe a pregnant woman, that's where the baby comes out from, like the neck to the womb. That's the best explanation for a cervix. So when that part is infected with cancer, it's called cervical cancer. And a man cannot come down with cervical cancer because a man does not have a cervix. So cervical cancer is a deadly disease. As we all know, all cancers are deadly, but it's not death sentence you if it is diagnosed on time. However, now we have a vaccine that prevents cervical cancer, and it's for our girls 9 years of age. Like I mentioned, it was we had a campaign last year for girls 9 to 14 years, but now we're giving girls that just attained the age of 9 to help prevent cervical cancer in future and reduce mortality rates for women in Edo State.
Irene Uabor, thank you so much for coming on the TV and
Thank you
radio
very
on
much.
the program Earth Matters. I'm sure next we'll call on you. You're going to be talking to us as what will happen to a male child that is of 9 years. Now, so thank you very much.
Thank you.
Thank you.
Thank you.
Bye for now.
Bye-bye.